The ones that are not trained, always, they need to refer to the specialist in cannabinoid medicine all the time if they are not trained, because of course, this is not considered yet like specialty, like per se university degree. But I'm going to give you an example. In Colombia, I am a co-creator with a diploma certification that is, we did an alliance with one of the biggest universities in Colombia. So we are certifying doctors with a formal education training certification that is 120 hours. So they get their diploma. It's not like a 2 days course or 8 hours course, because what I've seen with the majority of the specialists and the doctors, the ones that they said they don't want to prescribe medical cannabis is because they don't know how. And they don't feel confident doing like 1 day course or 8 hour course, because they know that CBD, THC, just talking about those two cannabinoids without going to the other 400 compounds of the plant, they have different interactions with drugs, medications, and other interactions, so they are afraid. So once you remove the stigma of the through a good education, the doctor will feel confident. That's very important. So if the physician is not trained, definitely needs to look for specialists in medical cannabis. But I think that the only way this will happen is to be promoting education. And this is what I was doing the last 2 years with the Faculty of Medicine, University of Panama, doing educational conferences, academic conferences. Even during the pandemic, I did conferences, and I saw the medical community very, very interested. I had in the conference and the lectures I were giving 300 doctors, 200 doctors and students of medicine, of different health care practitioners. So I see a big interest about learning in Panama. I actually got invited recently to give a lecture at one of the hospitals in the interior in Sona. Also, this month, I will lecture for the Academy of Medicine in Panama. So I see this growing interest in the scientific community and in the doctors to learn more. And so I think that's very, very important. And I think I always say to the doctors, I'm used to lecture, and I am an honorary professor of the diploma certification in Mexico, in Peru. I created an educational, I am part of an educational program in Brazil for doctors in Brazil, in Colombia. So I do see that it's so important to create a reliable sources of information for the doctors, so they will feel confident at the moment of prescribing. All the doctors that I hear that they say, I don't believe in medical cannabis. I said, you don't have to believe. This is not a religion. This is scientific based medicine. So it's not about believing. It's about reading the papers, the British Journal of Medicine, New England Journal of Medicine. This is not about believing or not believing. We have science behind a randomized controlled trial, systematic reviews. So it's education.